Hi, everybody. Welcome to Social Determinants of Health. My name is Dr. Alexis Koskin. I'm a public health professor here at ASU, and I'm really excited about teaching this course and guiding you along the way because so much of it really does have to focus on exercise and wellness and nutrition. Oops. And it also very much has to do with my favorite topic, which is the prevention and control of disease, public health. In this class, I really want you to think about how context and how the context of your life shapes your options and in turn, whether or not you have choices and how that affects behavior and health outcomes. So to begin, here are some tips that you might have heard along the way from healthcare providers about how to live a healthy life. Don't smoke, and if you can, stop. Have a balanced diet with plenty of fruits and vegetables. Make sure you exercise enough, at least 3 times a week to be exact. Manage stress healthfully, like taking time and breathing and talking things through, planning and relaxing getaways. If you drink alcohol, do so in moderation. Cover up in the sun. Practice safe sex. Make sure you get your regular health screenings from your primary care provider. Be safe on the road and learn the first aid ABCs. Now, these recommendations are great, and you probably heard about them along the way in your life at some point in time by health educators. And while they are useful in helping to promote awareness about how to live a healthier life, what they don't take into consideration is life context and something that we'll learn more about in this course, the social determinants of health. So taking a more focused approach and understanding life context, here are some recommendations that you probably haven't heard from your healthcare provider, but that definitely impact your health. Don't be poor, and if you can, stop, and if you can't, try not to be poor for long. Live near a good supermarket. Make sure you can afford and you live close to fresh produce outlets. Live in a safe neighborhood that's got lots of green space. Work in a rewarding and respecting job where you feel like you have control over your work. If you work, don't lose your job. Take vacations and all the benefits in which you're entitled. Make sure you have wealthy parents. Don't live in low quality and damp housing. Be sure to own your own car so you don't have to rely on public transportation. And learn how to fill out a complex housing benefit application before you become homeless and destitute. So what these have in common are, they are 10 recommendations, but what's so entirely different is that this particular set of recommendations is more aligned with population health and what would impact health outcomes from a more socioeconomic perspective. And also, those last 10 recommendations really do not assume that an individual is fully empowered and wealthy and living in privilege, but rather is taking people's life context into consideration. And that's what public health, as well as the social determinants of health, what it really does. The social determinants of health are looking at all of these societal factors such as income and education and housing and where you live and your zip code and other the culture in which you grow up in, and try to say, how do all these social factors impact the context of your life and in turn, impact your choices, lack thereof, and in turn, health behaviors and health outcomes. So this picture in the middle is from Healthy People 2020, and all of these pictures around this center picture are just illustrations of what are in these circles around the SDOH, the social determinants of health. This comes from Healthy People 2020, and which is from healthypeople.gov, where there are set objectives and recommendations for how the United States can improve health and health outcomes for the next 10 years, right? And each 10 years it restarts, so there will be Healthy People 2030 next. But basically, the healthypeople.gov groups a lot of the social determinants of health into economics, education and access to education, your community and social context, health and healthcare access, and the neighborhood or the built environment, all of those constructions that are in your natural environment. and how they impact your social determinants of health. They are all aspects of your social determinants of health. I like this picture because it's neat and clean, but in reality, these all interact. Your economic stability impacts where you live and what's in your environment. It impacts your ability to seek education. It impacts where you live and what is that community context like. It impacts your access to care. Your education and your educational attainment impact how much you're going to earn later down the road and how that impacts the environment in which you live and how that impacts your health and healthcare access. These are not mutually exclusive little bubbles. They all interact and influence your social determinants of health, which down the road, downstream, will impact your health outcomes. Your book outlines other social determinants of health. So again, briefly look through this list. These are all things in which we'll touch on in this course. Taking a lifespan development perspective. That becomes especially important when we talk about what happens in childhood, what happens during those stages of bonding and attachment when you're an infant and a toddler with your primary caregivers, how that impacts your school age health, your adolescence, and in turn your adulthood. This picture, I hope this picture excites you, and I'll describe why. As future public agents of change, right, or public health change agents, we're always interested in how can we improve people's lives? How can we help people, right? Usually people that are in exercise science and nutrition and public health, they're naturally pretty helpful people. And they want to do good. They want to improve people's health outcomes. This picture tells you that of an individual's health and well-being, only about 30% of it's predicted by genetics, and the rest is predicted by an individual's behavior, their social and environmental factors, and healthcare access. Look at that, only 10% is really influenced by healthcare, right? We think about treatment and even some of those prevention resources. And so really about 70% of all of health and well-being related outcomes, and even that which is indicative of risk for premature death, is really only 70% is predicted by social determinants of health, whereas only 30% are predicted by other factors like your genetics. And so I want you to take this information and realize that by understanding the social determinants of health, you can have impacts on individuals and populations via policy, by changing the environment, by changing built environment, by focusing on economic reform. You can reduce the risk of adverse health events by up to 70% for individuals, just by, again, taking into consider social determinants of health. So remember, there's so little that really focuses on a person's personalized genetics, but so much is really about that environment around them and the social determinants of health. So for our next set of slides, we'll talk about upstream and downstream factors. And then finally, we'll talk a little bit more about this social ecological model and why it's important to take that into consideration as future health professionals.